Bug bites can be common, but it's important you're aware of the symptoms that may need attention from medical professionals. Dr. Susanne Spano is the director of the Wilderness Medicine Fellowship at UCSF Fresno, and she breaks down all we need to know about bug bites.
I think in the Central Valley, the most common bug bites that we see in the emergency department are bug bites by whatever bug that become infected because people scratch and break the skin. And so it doesn't really matter what bug causes that if there's an infection. But in terms of bug bites that are specific, people show up for mosquito bites, black widow spider bites, and bee stings. Most people show up for the bee stings because they're concerned about a local or allergic reaction. Most of the really severe allergic reactions, about 90%, will occur within the first hour. And so if you're not really seeing a severe reaction by then, unless there's a prior history of a severe allergic reaction, usually you're pretty safe to do conservative measures at home. The wasps are special because of a lot of reasons. Obviously, they're usually defending their nest, and there's two different types of wasps. There's a paper wasp that we have with the kind of mud-looking enclosures that they live in that are up high, and most people get really stung by those because they're trying to take down the nest while it's still their season. That's probably a terrible idea, and just leave that nest alone until really they're dormant in the winter. Most other bites and stings, as long as there's not a lot of scratching to the area, will resolve on their own. So any kind of topical lotion, like a hydrocortisone cream that reduces itching, is really practical, good first aid care because it'll prevent that wound from getting more angry. You do have to be careful of using home remedies because you might be putting something on there that will really irritate the skin and make the condition worse. So try to stick to things that are more recognized in modern medicine so that we know how to treat you when you come into the hospital. Prevention is really the key to happiness. So I would definitely say that treating yourself with bug spray when you're out. There's a lot of ways to do that. There's spray-on bug spray with DEET. There's also DEET alternatives. So there's a Cutter Pleasant Protection that doesn't have DEET in it, which is very effective as well and is kind of dry to the skin. We do have a lot of illnesses that mosquitoes carry that we see in the valley. We've certainly seen children with West Nile here. So that's sort of a flu-like illness that occurs 5 to 15 days after the bite. Again, the majority of people with West Nile don't have any symptoms, but about 1 out of 5 do. And I have friends who've had West Nile encephalitis, which is very serious. So West Nile is something we do deal with here in the Central Valley, and it's something, if you have a flu-like illness in the middle of the summer when flu is not prevalent, maybe it's COVID, maybe it's West Nile. So that's something I would definitely get checked out for. That would be a life-saving intervention.